everyone, my name is Vivian, and my topic for the case write-up is performance management for healthcare administrators in Orange County, California. So throughout the semester and while working on the final presentation, I've learned that what separates from a poor performance management and a well-done one. And discussing what I've learned, I will include how poor performance management is derived from the lack of supervisors. I'll provide a solution and an example of what performance management should be, what can be avoided when creating one, and how the employee is affected. I will also mention the mistakes supervisors make so it can be avoided. So what is a performance management? Performance management is a process for setting up a shared understanding of what needs to be done and achieved at an organizational level. In the word performance management, they often think of performance appraisals or reviews, like that annual thing that everyone is scared of. But a performance appraisal should only be a small part of the performance management. While it is a misconception that only lower level employees receive performance management, everyone of all positions, including healthcare administrators, receive a performance management as well. And so as managers and board members, and there's such a negative connotation when discussing performance appraisals. And this misbelief derives from supervisors creating a demeaning and condescending experience for all their employees. And this fault lies upon the organization and supervisors. It's really crucial to correct the supervisors' mistakes and hold them accountable to maximize the employee's potential. And supervisors and healthcare leaders need to commit to the performance management because it allows the organization to recognize the employee, boosts the employee's engagement and productivity, and creates transparency. Introducing my case problem, a big obstacle with performance management is the lack of commitment from supervisors and guidance for straightforward implementation. During performance management, the supervisor's purpose is to set a goal and align with it and continuously monitor while reviewing the employee's progress. My case is relating to a healthcare administrator in a private hospital in Orange County, California. The healthcare administrator did not consistently follow up with the team member's performance, which later led to a low performance appraisal. The healthcare administrator did not check on with their employee, and as a result, the annual performance appraisal felt subjective and punitive. Not only did the employee suffer due to the supervisor's incompetence, but the organization did as well. There is a lack of transparency of what needs to be accomplished to meet certain goals because of the time gap between the beginning of the year and the performance appraisal. So, introducing my case solution. The employee expressed concerns about having a more active presence with the performance management to the healthcare administrator to address the case problem. The employee also expressed his concern with other managers and the director of the department, human resources, assigned additional training for the healthcare administrator per performance management. There is also a new performance management strategy to benefit supervisors and employees. The effectiveness of implementing the performance management mandates the cooperation of employees and supervisors. And also when discussing this new performance management strategy, the hospital and its board members have decided to add meetings before performance cycles to remind employees of goals, responsibilities, missions, and objectives. So these meetings will again remind supervisors of their role in the process of guaranteeing success in performance management, and supervisors will now have frequent and informal feedback meetings to ensure the employee development is on track. Supervisors will consistently provide any concerns or feedback about performances assigned to the projects and overall progress toward achieving the performance expectations. There will also be reminders of relevance between the work being accomplished to the organization's goals, and the purpose of the feedback meetings is to clarify and help employees understand their progress in the performance and also provide a chance to recognize mistakes and to improve. A subordinate appraisal will be added along with the annual performance appraisal. And to avoid the healthcare administrator's previous error, it is mandated for supervisors to be evaluated by their subordinates. To conclude my presentation and my case write-up, performance management is only successful when the employee and supervisor are both cooperating and actively staying on track. The case discussed exemplifies that it requires a balance of both goals and objectives to be achieved. The critical benefactor is the employee, but the supervisor plays a very critical role in the performance management. The program requires supervisors to be more active and a subordinate appraisal. There was a fear of supervisors giving negative feedback about the increased involvement and subordinate appraisals, but there were none. And after improving the performance management system, employees were satisfied because it included regular feedback about the assigned projects and overall progress toward achieving the performance expectations. The frequent and informal feedback meetings made annual performance appraisals not as punitive and demeaning as before. Performance management should always aim to be the most effective and efficient. Even though subordinate appraisals are uncommon, it should be included because it is another way to help correct supervisors. And that wraps up my whole presentation. Thank you everyone for watching and have a wonderful day.